Because we use these devices, breathalyzer machines, we read what's on the screen and we act on what's on the screen. So if you're reading a value on the screen and you think it's blood alcohol, but it's actually breath alcohol, then you are overreacting by 5 times.
Can they attempt to manipulate blood alcohol or breath alcohol tests for that matter? And if so, how?
Yes. Well, it's breath alcohol ultimately that they'll be manipulating, you see. It's this myth that if you take certain substances, it will interfere with the ability of the sensor to pick up the alcohol. It's a myth.
Hello and welcome to My Safety Hub, your go-to source for all things health and safety. We are here at the Saiosh Conference 2025 and we are joined today by Dr. Greg Q, specialist in occupational medicine. Doctor, very welcome to My Safety Hub and an absolutely brilliant presentation on workplace testing for alcohol and drugs. It was really informative, and I have a few questions with regards to that presentation of yours. So first up, we spoke about breath alcohol versus blood alcohol testing. Can you explain the key differences between breath alcohol and blood alcohol testing in the workplace? And what are the implications of those differences for testing protocols and naturally disciplinary actions?
Yes, exactly. It's really an important point, and arguably one that doesn't naturally surface in conversation because we use these devices, breathalyzer machines, we read what's on the screen and we act on what's on the screen. Now here's the thing, is that the device is obviously not measuring blood. It can't. It's you're breathing into it, so it can't be actually your blood. So how can it then give us a blood alcohol concentration? And why must it? Well, it must give us a blood alcohol concentration because all the laws and all the reference points and all the values against which we act are all blood alcohol concentration. So what it's doing is it's applying a couple of fortuitous scientific facts with many years of research. The fortuitous one is that the levels of alcohol in the blood very closely match what's going on in the air that we breathe out, because there's a reliable crossing of alcohol from the blood through what we call the membranes that are keeping the blood in the bloodstream and the little alveolar respiratory sacs in the lungs. So that alcohol diffuses across into the respiratory system and you breathe it out at a very reliable and predictable rate, which is what these machines rely on, and the courts rely on. They rely on the fact that that's a predictable number. So that we breathe into this machine, it's breath alcohol sitting in that breath, and it goes into the machine that runs an algorithm and produces a blood alcohol concentration result, and the courts believe it. Because, as I said, this is research that's been going on for a long time. Here's the problem. Breath alcohol concentration is about how much alcohol is in the breath. So the machine measures directly, and then it calculates blood alcohol concentration. But the machines have to be set up to tell us, is it displaying the breath value or is it displaying the blood value? Now, what you may discover, as we did in an audit recently, is that sometimes the supplier supplies it with a setup on breath alcohol concentration and the user doesn't know. They get a result and they act on it, and then they think it's a blood alcohol concentration. Now, why that matters is because there's a 5 times difference between breath alcohol concentration, the number on the screen, and the blood alcohol concentration number. So if you're reading a value on the screen and you think it's blood alcohol, but it's actually breath alcohol, then you are overreacting by 5 times. Now, that's a big number. And you may well be sanctioning people and acting on these results entirely unfairly. And so, sorry, long answer to the question, but that's really why we need to know there's a difference between breath alcohol and blood alcohol. It's worth also knowing that the courts are comfortable with that formula that the machines run. We don't have to be frightened of it and say, oh, well, will the courts believe it? They do, because the research has been done for so long. But you must just know what you're reading when you read that device.
Of course, so it is vitally important for the employer to differentiate which measurement they are taking, because that could have dire consequences to the employee that they are busy testing. So further on to the testing of the individual itself, can they attempt to manipulate blood alcohol or breath alcohol tests for that matter? And if so, how?
Yes. Well, it's breath alcohol ultimately that they'll be manipulating, you see, and then the machine translates that into a blood alcohol. So what they're aiming to do is change the amount of alcohol in the breath. And how would you do that? Well, either you dilute it or you tamper with it, you try and interfere with the machine's ability to read the alcohol. And that's where some of the myths come from. If you eat garlic or a strong aromatic substance, even drink strong coffee. I heard a recent one was a bar one chocolate.
Oh goodness!
There's this myth that if you take certain substances, it will interfere with the ability of the sensor to pick up the alcohol. It's a myth. So that's one of the strategies is that you take something that I think is going to interfere with the ability to read the alcohol. The other then is to dilute. Two dilutions sort of work. In the past, if you took an asthma pump, for example, and you breathed in an asthma pump,
oh goodness,
the propellant inside there will go into your lungs and will dilute the quantities of ethanol that the machine is going to pick up.
Oh wow!
But modern machines apparently are not fooled by that anymore. But that was a thing in the past. The other way to dilute it is to hyperventilate. If you hyperventilate just before the test is being done, you can drop your breath alcohol concentration by up to 20%. Can you believe that? And
that is substantial.
Yes.
Yeah.
So it's really about diluting the alcohol in the breath. If you breathe in and out rapidly, you'll more approximate natural quantities of alcohol in the outside air, which is naught,
Sure.
diluting what's going in the lungs. If you drink a very ice-cold drink, what that does is it reduces the vapor pressure of the ethanol in the air because it's temperature dependent. The warmer, the more ethanol is vaporized, the cooler, the less. So if you have something that's going to cool your breath as much as possible, look, you're not pouring it down your lungs, but you're putting it in your mouth, and if you breathe that cold air down, the machine might reduce its ability, or it may reduce the ability of the machine to pick up that alcohol because it's now not that vaporized. You're not going to make a big difference with the cold water, but you could with the hyperventilation.
That is very interesting, and I think that's a very important point for, again, the employers to understand. So these are signs that they can look out for.
Quite right.
If they presume an employee is under the influence of alcohol. So if they see a guy hyperventilating just before the test, that might be a key indicator that maybe he is guilty of that.
Yes, he's trying to hide something.
Trying to hide something. Let's pivot more onto cannabis and the drug side of this testing. So when it comes to cannabis testing specifically, what is the difference between detecting recent use versus actual impairment? How can employers determine whether an individual is truly under the influence of cannabis versus simply have used it recently? Because that's a hot topic we are currently sitting with.
Yeah, exactly. And even the nature of the question makes it something that needs to be sort of teased apart slightly, because inferring intoxication automatically is a tough thing to do. You know, we're talking about evidential, let's say evidence that the person showed signs of intoxication, as opposed to inference. So what I mean by that is if you do, for example, a breathalyzer test with alcohol, so we're not talking cannabis yet, you breathe and you get a value that's over a particular limit. Let's say it's over the limit for someone driving on the road. That's not evidence of impairment. That's evidence of a value of alcohol in your breath, which according to science is very likely to be impairment. So it's inferred impairment. We do the same with cannabis. So the cannabis version of that is a saliva test.
Okay.
So saliva cannabis test measures the actual delta-9 THC in the system, which is a little bit like blood alcohol, breath alcohol, cannabis in the urine, in the saliva, cannabis in the blood. And so that is an inferred value of saying you've got delta-9 THC, which is the psychoactive ingredient in your saliva, and therefore it got there after having rinsed out your mouth, it's got there from the bloodstream. So the correct interpretation of a saliva test is not under the influence, it would be over the limit of a psychoactive substance, delta-9 THC, like alcohol is a psychoactive substance. Now, that's different then to the usual drug tests, which are urine tests. Now, urine test is to test that the person has used the substance. So let's take cannabis, for example. It's a constitutional right to use cannabis, like it is constitutional your right to have alcohol. So if you test someone with urine, on the urine level, you're only confirming that they're using cannabis. You have no idea when they used the cannabis.
Yes.
It could have been last week. It sits in that's the scientific awkwardness of cannabis, is it hangs around for a while. The inactive metabolites in the system, after having been metabolized by the liver, they can be in the system for days. For a regular user, it can be there for weeks.
Sure.
And these are all inactive substances that are being measured in the urine. They're inactive, and they're just a signal this person's a user. So for you to act on that would be to act on a person who's doing something they're constitutionally allowed to do, without any really clear inference that they were impaired at the time, and therefore you were doing it out of a safety imperative.
Yes.
You literally just picking up that they're using it. Now, maybe just a quick mention, you didn't ask, well, what about others? If you did a urine test for something that is an illegal substance, for example, and you picked up the person's got methamphetamines in the urine or heroin in the system, now there, all you need to show is use.
Yes.
You don't need to say whether you're impaired or not, because those are illegal substances. So when cannabis was still illegal, that is what we did. If it's in the urine,
Surely checking just for the usage, right?
just use is good enough. You're now in breach of the law, and therefore it's you can act on it. The moment it was no longer illegal, it moved away from like heroin and cocaine and tuk and the like. It moved into the space of legitimate use. So and that's really how the shift happened. You have to now use a different strategy to just use.
Oh, well, that is very, very interesting. So again, the one measures just the usage thereof, and the other one actually sees if you are within the limit or without the limit.
Exactly.
So with the testing, what are your thoughts on the accuracy and reliability of over-the-counter drug tests, and even breathalyzers for that matter? And can they be trusted to prove accurate results in the workplace?
Yes. Oh, exactly. That's what it's about. So I'll start with the alcohol one. The legitimate breathalyzer equipment and the variety of manufacturers, those are very reliable. As long as you actually use the confirmatory mode on those devices and you use them correctly and they're calibrated and the like, then you can take that to court. Tests for drugs generally, though, is a different story altogether. Those are screening tests, and even good ones, whether you buy it from over-the-counter at the local retailer or from a reliable source, the nature of the let's say that the testing technology, ELISA, which is the technology used, it's similar to technologies we do for pregnancy tests, for example. It's just not sensitive enough to act on its own. And the analytic sensitivity of these devices at the thresholds they quote, so they'd say we can pick up THC at 50 nanograms per mil.
Sure.
Well, they do that at 50% sensitivity. That means it's missing a lot both ways. You see, but it's sort of what's accepted as the threshold for calling it a test device for that particular cutoff value. Okay. So the user must understand that if they're going to use a screener, that it's really there as a screener. It's inexpensive, it's convenient, no one's criticizing that. But then if you get a result that is what we call maybe positive, we don't call it positive, we call it non-negative because of the lack of sensitivity and the other problems too. I'll come back there, but then you must confirm. Okay. So apart from the sensitivity, there's also cross-reactions. You could be taking a medication, for example, that's entirely legit. I've had a case of a person taking anti-ulcer meds, and came up positive for amphetamines, and that's entirely possible because the molecules are sort of similar, and as long as the molecules are fairly similar, the screening test can't tell the difference, but the confirmatory test can.
That is very interesting. And just a closing question from our side, with that being said, what happens if you now test over the prescribed limits? Is there a dispute procedure or a reason for an individual to dispute a certain result from these tests we spoke about?
I suppose. I mean, I think possibly the disputes might lie in the manner in which the program is conducted. The dispute might be about, I didn't know it was a rule.
Sure.
So there are certain prerequisites that we call procedural fairness that the employer needs to follow, and that is that they've procedurally done this the right way in order for a sanction to be upheld. That would be one. The other might be to dispute the veracity of the test itself, and that's where you'd really want as an employer to have the screening test be at least approved from a quality point of view, and there's a quality standard that comes with them, and that you've done the confirmatory test. And the confirmatory test really is a gold standard. It's very hard to dispute the positive outcome of a toxicology lab.
Yes. No, thank you very much for that. Right, Dr. Greg, thank you very much for your valuable insights today. It was really informative, and I think for the viewers out there as well, they really learned a lot from this conversation. So thank you very much for sharing that with us, and we wish you all the best for the future.
Pleasure. Thank you so much for the invitation.
Pleasure.
Looking forward to the next time.